Good afternoon. Hope everyone's joining us this afternoon. Thank you for signing on and welcome to the season finale of our four-part virtual summer series. We are eagerly looking forward to our upcoming season in the fall, and it has been an exciting this summer to expand our 9-month signature series that has served the platform for extraordinary speakers over the last 46 years to a new stage this summer as we've gone virtual for some of our events. My name is Allison Millington. I am the Senior Vice President at Penske Entertainment and wanted to welcome you all for joining us this afternoon. I'm also honored to serve as the immediate past president of the Economic Club of Indiana and have served as president this last season and through the summer hosting these impactful conversations with some of our top top of our leaders in our country, and we're joining today, have another one joining us today, which we're excited to introduce. With the new virtual summer series, the Economic Club continues its mission to bring timely and engaging leadership perspectives from various industries and sectors on the economic and social impacts of current events. Before I introduce today's guest, I'd like to also take a moment to thank our presenting sponsor, Lumina Foundation, and our outstanding platinum sponsors that were highlighted at the very beginning of the webinar when you signed on today. We want you to be part of the conversation, and we will hear remarks from today's guests, and we invite you to use the chat feature and ask your questions. And I'll be looking at those, and those will allow you to be a part of this important dialogue. Questions can also be shared on Twitter at Economic Club IN at the end, Economic Club IN, or using the hashtag EconLunch. Our topic today is important and it's timely, and our speaker today is the perfect person for our discussion on resilience and community health. We're excited today to welcome a great man, a great friend, and a community leader whose passion for what he does in every single thing he touches is unmatched. He is a needle mover and has done so much for this community, for this state, and across the country that we are thrilled he found the time to join us today. Chad Priest is the Chief Executive Officer of the American Red Cross Indiana, leading a team of 3,500 volunteers and staff from 45 offices throughout Indiana, portions of Ohio, Kentucky, and Illinois, all dedicated to alleviating human trafficking and supporting resilient communities. He's also an adjunct assistant professor of emergency medicine at the IU School of Medicine, a faculty member and co-founding director of the Disaster Medicine Fellowship Program, an adjunct assistant professor of nursing at the IU School of Nursing, and an affiliated investigator at the IU Center for Bioethics and the IU Crisis Technologies Innovation Lab. He is a man of many, many talents and credentials. And before assuming leadership of the Indiana region of the American Red Cross, Chad served as the Assistant Dean for Operations and Community Partnerships at the Indiana University School of Nursing, where he also founded and directed the Interdisciplinary Social Network Health Research Laboratory. So again, he's done a lot. Prior to his time at the IU School of Nursing, he was CEO of the MESH Coalition, which is where I first met Chad, working with him on the Super Bowl. It was an innovative public-private partnership that enables healthcare providers to effectively respond to emergency events and remain viable throughout recovery. And he has also practiced public health and healthcare law at Faegre, Baker & Daniels. So without further ado, Chad brings robust knowledge around international disaster risk reduction, healthcare, emergency management, crisis leadership, and community resilience to disasters and crisis events. So I would like us all to welcome Chad.
Thanks, Allison. That is quite an introduction. I'm just
Yes.
gonna, now I think we're recording, so I'm just gonna play that back every time I'm feeling down about myself. It's nice because these things get set up so you automatically feel like an expert, but actually what I'm gonna talk to you today is about disclaiming expertise. So take all that stuff and assume I know very little. Such a pleasure to be with you. Thank you, Allison, and appreciate our many years of partnership, which have really meant a lot. It's really an honor and a pleasure to be with all of you today here virtually. I wish we could be together in person, but I'm thankful to Kathy Langham and all the leaders of our Economic Club for creating this summer series. And before I begin, I want to take a moment to extend my deepest thanks, really on behalf of all of us here, to my colleagues in public health and social service organizations who really are doing some of the hardest work imaginable. on behalf of all of us. And I include my amazing team of staff and volunteers at the Red Cross here. I could not be more proud of them and the work they are doing, along with all sorts of partners in our hospitals, our public health organizations, and our social service organizations. They deserve our respect and gratitude. They certainly have mine. So let me get started by pointing out the obvious. If it feels like the world is shifting underneath us, it's because it is. We are in the middle of a global pandemic, yes, but we're also in the middle of a shift in disaster threat around the world. So while natural disasters are actually declining slightly globally, their impact on human beings is increasing dramatically. So human-caused disasters and human-influenced disasters are colliding with massive changes in where and how humans live. So climate change, food insecurity, war, civil conflict have caused global migration, millions displaced around the world, and the migration to cities means that the impact of disasters in cities is amplified, right? So more people there, things happen in cities, and that's really important. This migration is so critical, I think, to understand both disease burden and disaster impact. Consider that nearly 70% of the entire world is going to live in an urban area by 2050. That matters for us right here in Indiana as well. I think COVID-19 has demonstrated this dramatically. There is no escaping the fate of our planet. We are all connected, and every attempt we can do to disconnect, it just doesn't work. And so with that, I think what we're here today is to talk about how communities cope with disasters. So at the risk of stating the obvious, it's important to point out and emphasize that we cannot prevent disasters from happening. We can't prevent pandemics from happening. We can mitigate the impact of these events, and we must, but they will still occur. This is a message rooted of hope, though, and in some science, which is the good news is that our communities are hardwired to be resilient to these events. We just have to support their resilience much differently than we have in the past. And the clock really is ticking to take that action now. And that's sort of what I thought we'd talk about today, and then maybe have some discussion afterwards. So the word resilience is used so much, I think, these days that it's almost lost some of its meaning. So there are probably some engineers in the room. They understand resilience a certain way. They think about elasticity, this idea that things move and shift in such a way that allows us to build bridges and buildings and just about everything else we build. Psychologists use the term resilience. They think about individual resilience, and they've got a whole body of literature around how to support individuals to be more resilient. And in fact, in the psychological space, we've stopped talking about resilience, and now there's words like anti-fragility, becoming anti-fragile. So the risk is that this word loses some of its meaning through time. But in the world of community health, in the world of emergency management and disaster response, the world I sit in, we think about resilience as the capacity to recover quickly from an adverse event. A tornado, a fire, a drought, a global pandemic. It's easy to think about resilience as a rubber band and to think about it as simply bouncing back. This, though, is problematic. And so today I want to challenge us to think about this slightly differently. It's problematic because we know that disasters rarely impact people equally. So while a tornado or a hurricane has the appearance of a neutral weather event, the impact of these events is anything but neutral. Disaster impacts different social strata in our communities differently. Our neighbors who live in vulnerable areas, so those who live in low-lying or flood-prone areas, are more likely to lose their homes or to be housing insecure following these events. Those with limited financial resources or social capital, they're less likely to be able to evacuate in the face of a hurricane or shelter in place in the case of a pandemic or a public health crisis. And so in public health emergencies, we know that the pre-event health status, right, how well you were before this event occurs is highly correlated with your post-event recovery. How fast are you going to bounce back? And because of these disparities, because we know that disasters shine light on social faults in our society, getting back to a status quo that was unjust or set people up to be less well, that really feels inadequate. And so what I want to talk about today is thinking about bouncing back better. This isn't my phrase. This is a phrase that's been used in the international development world for years. And this idea that we have opportunities in crisis to think about recovery, not as a return to the baseline, but as a springboard to the community we want to be in and be part of. I think it's hard sometimes in the middle of crisis to think about opportunity after the crisis is over, but that's exactly what we have to do. And that's what I want to talk a little bit about today. So before that, though, when I talk about community resilience, most of the time, I usually have to start by unveiling for the audience the limitations of our formal response apparatus. That is that very finite capacity of our ability to rescue folks from disaster. In the old days, but before COVID, this would often come as a shock to people. And I think now it's fair to say that there isn't a human being on the planet who doesn't understand the limits of our ability to respond to crises. But in case you need to hear it, let me say it. There isn't enough. Just insert whatever you want after that sentence, okay? There isn't enough stuff. There isn't enough people. There aren't enough rescuers. And this is a fact that for emergency managers, people that do this work full time, we know this very well. This is the way we plan for events. But I think we have talked so much about rescue, right, in our country. Everything is built on rescue capacity that it's easy to forget the fact that we don't have that capacity for large scale events. So if our plan is to rescue our way out of a disaster, any disaster, we've already lost. If you go and this is the invitation, find someone that you know that works in disaster or emergency management, buy them a beer, buy them a cup of coffee, and say, hey, I saw this guy at the economic club and he said there's just not capacity to rescue. And I think what they'll do is they'll put their coffee down and say, yeah, that's right, right? And there's good reason actually for that. That isn't a criticism. If we spent the time, resources, and money to prepare for rescue, we wouldn't have a lot of any of those things to go out and thrive. So that isn't a criticism, but I think it's so important to recognize we will never rescue our way out of large-scale disasters or pandemics. So if this pandemic teaches us anything at all, it should be that we better listen to the lessons that we've learned from every other pandemic. And by the way, we've had a lot of pandemics, right, over a long time. So it's not a surprise we're in one now. We'll have one in the future. They don't come at regular intervals. So sometimes we're not, we might think, oh, it's been forever, but it really isn't true. In fact, we're still in the middle of a huge HIV/AIDS pandemic, which is still wreaking havoc all over the globe. I told you I was here with a message of hope, and so far I have not delivered, but stay tuned because there is hope here. And the hopeful part is we actually know how to do this. We actually know. Just being in my neighborhood and being on Zoom meetings, I have friends and loved ones and family members saying, I can't believe we don't know what to do. And I keep saying, well, we do know what to do. But it's very different than the rescuing that we're undertaking now. So as I get into this, if anything I'm about to tell you will ever make sense, I have to get you to agree with me about a few things. And as Allison alluded, I'm also a lawyer. I'm a nurse and a lawyer. And I always joke, I tell people, generally speaking, I lead with the fact that I'm a nurse. That tends to go over better in groups, but very proud to be a lawyer. And this is a lawyer trick, which is I get you to agree to a few things here, and then everything else I say in the presentation, you automatically agree with. So here we go. First, you got to agree with me that all communities, particularly those that experience disparities during non-emergency times, can strengthen their ability to bounce back better after crisis. If you don't believe that, then there really is no point in investing in resilience activity to begin with. Second, we cannot treat communities or individual members of communities as unavoidably reactive or helpless in the face of disaster, because they're not. Indeed, communities and individuals have extraordinary strength. Our job is to unleash it. And that is a big challenge for all of those of us that are very concerned about helping folks after crisis. And finally, as we talk today about resilience, keep in mind, we're talking about the community as a unit. And the resilience of the community is not the sum of the individual resilience of everyone in it, right? So we could put all the Chuck Norrises in the world together, and it doesn't mean that that community is going to be more resilient. The community is this unit into itself. It's this dynamic social structure. And we really understand that the social structure and dynamic of communities is really well studied. And it's a critical lens to use in understanding the forces that shape our response to public health emergencies and disaster events. So, what is the difference that makes a difference between communities that bounce back after crisis and those that don't? Again, now we're at the hopeful part. We actually know, and it's science. We call these the social determinants of resilience. And these are those social factors which determine community resilience to adverse events. They are highly correlated with recovery from these events. And while we call them the social determinants of resilience, I'd like us to think about them as the social determinants of our survival. And so what are they? Well, there are a few. I'm going to name them. I'm going to tell you a little bit about each one. We have a very brief time together today. So what I'm really hoping to do is introduce this concept, encourage some dialogue, and then, this is something I could talk about for 50 hours, which I know would really excite many of you, and you're always welcome to buy me that beer. I'm happy to do it. So the first factor as we think about communities is the physical and psychological health of the community. Underline this, highlight it, bold it. Pre-event health status matters. Pre-event health status matters. The health of the community, the physical and psychological health of the community matters. We know health status is not equal in Indiana. We know that health status is higher or lower based on a function of a myriad of primarily socially modifiable conditions. So we know racism causes poor health outcomes. We know that low-income families and communities have poorer health outcomes than those with means. Those are socially modifiable factors. So where we find strength in physical and psychological health, we have better recovery opportunity, and resilience is stronger. On the psychological health, this is really critical because there is this really interesting and fascinating interaction between our biological mental health, right, how we conceive mental health, and our social structures. Our understanding of things like allostatic load, the exposure to chronic stress that comes from poverty, actually rewires our response to stress. And this is a significant finding over the last 20 years that's really shaped the way we think about mental health in communities. So the physical and psychological health before an event is a really important mark. The second is social and economic equity and well-being. And I use the word equity very purposely. We are not talking about income equity necessarily, although there is some really fascinating research around that. What I'm talking about is the impact that equity has on our understanding and appreciation of the social dynamic of our community. And the start of our discussion of equity really came out of the social determinants of health literature and these wonderful studies done in Britain among British social servants in the Whitehall studies. And these studies look to see, does it matter if we took a group of civil servants and we examined them, would it matter if we saw people in one grade of civil service versus another in terms of their health outcomes? And lo and behold, controlling for their income, controlling for a number of other things, simply telling someone they're in a higher grade or rank changed their health outcomes. This is important because we also know our communities are not equal. There is a huge amount of disparity in our communities. And I think over this pandemic period, and especially this summer, we have seen a renewed emphasis on the criticality of addressing equity in our communities, in our organizations, and all over our state. So social and economic equity and well-being actually has a huge role to play in disaster resilience. Finally, effective risk communication. So one of you are all experts now in risk communication. How do I know you're experts? Because you are getting risk communication messages every 29 seconds about COVID-19. And as you know, how those messages aren't often effective. It's not that we're not trying hard, we're doing our best. It's that getting messages like vaccination or mask wearing or any of these things communicated in a way that people will receive them is exceedingly challenging. And we know some things about how these messages are best received. Spoiler alert, they're best received from peers. They're best received from trusted agents. So when I get on Twitter and I say, everyone, you should really wear a mask. I'd like you all to believe me, and I'd like you all to wear a mask as the governor has asked us to do, but I really understand that it is your peers, it is your pastor, it is your neighbor down the street that will have a whole lot of influence here. The other factor around risk communication is our understanding of risk. And boy, are humans bad at this. We are terrible at assessing risk. In fact, and I put myself right up here, I have been in situations in which I'm in my car, just don't repeat this because you're not even allowed to, now we have a new law. There's certainly no hand, touching your phone in the car. But back in the old days, right, long time ago, it may have been the case that I texted in my car a few times. And ironically, I was probably texting about some safety related matter. That is the perfect example of the limits of our understanding of risk. So here I am, hey, we better get this city ready for this potential tornado. Let me text that to you at 35 or 40 miles an hour down the road. We're not good at risk. Effectively communicating risk requires an understanding of the deep social dynamics in a community, and that is challenging. Integration of organizations is another critical piece of this. When organizations work well together, and I mean non-governmental organizations, governmental organizations, community organizations, when they work together well, good things happen. And boy, are we lucky here in Indiana. Everywhere I go and everywhere you go as leaders on this community, I know what you hear is, how did you get that done? How did you do that? And we're very good at this here in Indiana. What we have to be careful is that we don't leave behind community level organizations, or that we don't confuse our role in communities. We are not rescuers who rush into communities. Our job is to integrate our efforts, respect communities, listen to their needs, invite them to invite us in. And that's very important. I want to spend the most time talking about the last of these, which is my favorite, which is social cohesion. I can't see you, which is a huge limitation of Zoom. And I really wish we were together, because some of you could be shaking your head saying, no, don't go there, or giving me cues. But if I saw you, I would ask you all to say, raise your hand if you know the name and phone number of your neighbor. Think about all your neighbors. Could you call them right now? Could you pick up your phone and call your neighbors? My guess is most of you could not raise your hand. And I know that because I'm similarly situated. I can get on my computer and call friends in Europe or call friends in West Africa or colleagues, but I may have trouble reaching the person across the street. That is an extraordinarily dangerous situation we've created. And we have created it, right? And for lots of reasons. Robert Putnam wrote a seminal book about this in the late 90s, Bowling Alone, this idea that those routines and social structures that used to bind us so closely are changing. And I'm not a sentimental person. I'm not sure that it's good or bad. It's just, it is what it is. And we are less connected to the people right next door to us. Well, that's a big problem. Because if you don't know the person next door to you, and you don't know them well, you are less likely to do the very things we need you to do, because rescue may not be available. You don't know the person next door, you may be less likely to sweep their sidewalk when the snow comes. You don't know that the person next door to you may have trouble getting food, you may be less likely to bring them some groceries. We've got to start knowing our neighbor, because once you know your neighbor, everything changes. And I give you a great example of a Red Cross program that we run. It's one of my favorite programs. It's our home fire campaign. We are installing smoke alarms all over the state of Indiana. We've installed thousands and thousands. We've saved hundreds of lives through this effort. And that's great. But man, you know what's really great about our home fire campaign is when we can get neighbors to go into a neighbor's home and drill that alarm into that wall. Because now we've stacked this intervention. We've pumped it full of juice. Because now that intervention is not merely a smoke alarm. I've introduced two neighbors to one another. And man, I'll tell you what, the power of neighbors is exactly what has gotten us through crisis after crisis after crisis in this country. And it's the power that drives the Red Cross and the way we think about work, and it's super important. So the physical and psychological health, social economic equity and well-being, effectively communicating risk, integrating organizations, and social cohesion. So there you go, that's it. We just do those things, we're all good to go. That's not exactly true, but listen here. If we don't attend to those social determinants of resilience, we're never going to turn the tide. We're never going to turn the tide. So we have built the community structures that are enabling the spread of COVID-19, and that's accelerating morbidity and mortality. Consider it's going to take more than isolation, testing, and contact tracing to end this pandemic. Now, I want to be careful. It will require isolation, testing, and contact tracing, but it's going to require more than that. It's going to require more than a vaccine. It will require us to remodel the social structures that we've built. And those social structures, by the way, cruelly select some of us for greater sickness and suffering in the face of COVID-19 and other illness. And here's where it gets hard, because ultimately, acknowledging that we're never going to rescue our way out of these events, the intervention is us. We become the intervention ourselves. And indeed, some of the most valuable and impactful disaster interventions that you can see are those that don't really look like disaster interventions at all. I'm really proud to use this platform to announce one of those really exciting interventions. It's a partnership that we're really excited about in the Martindale-Brightwood neighborhood of Indianapolis with Martin University, Eskenazi Health, and Indianapolis EMS and the American Red Cross. We know that when we train people in CPR and first aid and those basic skills, that we empower them with the ability to make good decisions under tough conditions. And we're embarking in a project with these important partners to increase the number of people in this community that are trained. And that would be great all by itself. But we also know we have to build capacity for communities all over to be their own Red Cross, to be their own support. And to that end, Indianapolis EMS and Eskenazi Health are going to offer EMT training for graduates of our first aid and CPR courses and at no cost, and then redeploy, hire those folks into the EMS system, and then redeploy them back into the neighborhood to work. This is the difference between saying, let's go do something to a community, and let's invite partners to think with a community, follow the community's lead, respect their voice, and do something. We're not experts in the Martindale-Brightwood community or any other community. We are experts in helping neighbors band together to do really important work, and we're excited about this one. So my experience isn't evidence. I wish it was, because then I'd be full of evidence, but it is just my experience. But I have been doing this for a while. I have seen some stuff. I've seen my share of horrific events, from being at the Pentagon at 9/11 to working with family members after that event. I've been to countless disasters, seen hundreds and hundreds of people displaced on the front lines of the Ebola epidemic in West Africa, working with hospitals struggling with daily problems and large. I have seen some stuff. I have seen neighborhoods destroyed. I've seen houses destroyed. I've seen futures put on hold. But I'm going to tell you something. I've never, ever seen a community destroyed. Ever. I've never seen a community destroyed by disaster. And there's a reason for that. Healthy communities are hardwired to bounce back better after crisis. They do the right thing automatically. What we've got to figure out is we have to be about supporting their resilience. And we better do it quick. And we need your help to do it. So I hope all of you watching consider joining us in this important work. There's a lot packed into this very short mumble I've done, but really appreciate the opportunity to talk with you, and thank you all so much.
Thank you, Chad. That was absolutely inspiring, just as you always are, and I love your message of hope. As we go forward, and particularly the way that the last several months have been. I have a couple follow-up questions and a couple that were sent to me. You mentioned social cohesion. You also said that was one of your favorite, a focus of yours, and I couldn't agree more. And you indicated it was a really important determinant of resilience and communities responding. How do we build more cohesive communities? How do we actually do it?
So there are actually experts that think only about social cohesion, and I'm not one of them. So I'm a consumer of this expertise, but I'll pass on what I've learned from them. And it is wide and complex, but there are some simple pieces to this. The first is the actual built environment itself. Consider how we're building communities and cities. There is a resurgent desire, I think, and we're seeing this in new suburban development, to create communities in which people have places and spaces to interact, right? So you'll see retail built with green space in front, which, by the way, looks a lot like our old cities used to look, right? And so there's been, I'll give you a great story. I was on a CDC working group years ago, and they were looking to find markers for social cohesion. They're really hard to find. The evidence is really spotty. It's very correlative. And so they were looking at existing data. So there's a number of big national surveys that are done with families every year the CDC runs. And one of them asked questions like families that eat together, right? And would that be a good marker? And then someone in the room said, let's look at garages. Let's look at garages, right? And and truthfully, I was sort of like, what are you talking about? But the hypothesis that this epidemiologist was talking about was this idea that in communities where there are detached versus attached garages, right? So if you have an attached garage and you drive home and you hit the button and the door goes up and you drive in and you close it, you don't see anyone, you don't interact with anyone. And so they did some preliminary studies to say, is there any correlative data that could show changes in recovery? And of course, this is a big problem in disaster research. You have to wait for a disaster. And so we don't have great evidence. I can't sit here and tell you that if you have an attached or detached garage, you have more chances of being, cohesed with your neighbor. But it is really intuitive, isn't it? And when you think about things like that, you can think about apartment buildings. And if you've ever lived in a big city, you may not know everyone in your apartment building. You may not know all their names, but I guarantee you're going to recognize if you stop seeing someone or if you see something that's a little off, right? That opportunity to be near each other is really impactful. My daughter, when she was in elementary school, did a school project where she walked around the neighborhood and just asked people for their names and their phone numbers. And it was interesting because this was years ago and people gave them to her, but I don't think they were like, oh, of course, what a great idea. I think they were like, what are you selling? Or what are you doing? But remember when I grew up, everyone had a book of who was in the neighborhood. I grew up a block from where I live now, and I knew everyone on that street. I was the paper boy. I was the one knocking on the door selling, Boy Scout wreaths or whatever I was doing. And so there is something else about cohesion that's super interesting. Sometimes when we say community, that's code, right? That's code for the other. But and that's a bad habit we have to get out of, right? Because we start making assumptions. Oh, I'm sorry, poor communities do worse in crisis. And actually, it's not true. In communities where resources are consistently depleted, we actually see markers of increased cohesion. And that's because there is a need to pitch in and get it done. So whether that's sharing childcare responsibilities, whether that's considering, hey, I've got extra money on this SNAP card, I'll buy some groceries we can share, or I'll pitch in and I've got some groceries, whatever it may be. And so our assumptions about cohesion really do challenge us. And I actually worry much less about inner city neighborhoods where there's vibrant community, even though there may be poverty, than I do about suburban neighborhoods where there is no community, even though there may be resources. So at any rate, social cohesion is super important. That's a few thoughts, but I'll leave the rest to the sociologists who really are the experts here.
Okay, a couple more questions to follow up. What are some ways that resilience interventions can be applied to the current COVID pandemic that we are all still living in? We were all hoping it was going to be gone by now, but we're still in it.
Well, first, I just want to applaud the work of the state of Indiana and my friends, Dr. Box, Jen Waltall, Secretary Sullivan. I gotta watch that at FSSA, and the many folks who are doing really good work. We got a lot to be proud of in Indiana. I know the numbers don't look good now. I know we're all watching very carefully. We're worried. We're right to be worried. But I think we have shown what we know, which is Hoosiers respond to the call. We do the right thing when asked and pitch in. So I don't have a critique to level at all. I will, though, give you a story, which is in the early days of this pandemic, we really thought a lot about hospital capacity. And what's funny is I spent most of my career thinking about hospital capacity, and now suddenly everyone's talking about hospital capacity. And I thought, oh my gosh, this is going to be really fun to see how this plays out, because I'll be interested to see what happens. And so, we started talking about surge capacity in the public, right? And prior to this, I think there were 100 people who talked about surge capacity on a daily basis, and now it's on the lips of every American. Surge capacity is a problematic way to think about things, and I'll tell you what I'm talking about. We have to do it, by the way. You've got to do this, right? The idea of creating more space, getting the right ventilators, making sure that is all necessary work. It's just not sufficient. It's just not sufficient. And this is what those of us in hospital emergency management over the last decade have started to understand. So we have chosen, in response to COVID, to focus on capacity creation inside sick care structures, right? Structures that are designed to care for you when ill. You got to do that. What we have to do, though, is if we're there, we're too late. It's too late, because remember what I said earlier, we don't have enough stuff. We can't manufacture enough vents. We can't do enough beds. We can nationally get really close, and man, have our hospitals done a great job, by the way, of banding together and partnering, something, by the way, that's very hard in other states. Kudos, especially here in central Indiana, where our level 1 trauma centers have I think, done extraordinary work. But the point here is that that's not enough. We have got to take the fight into the front line, which is not the hospital. The front line's in the community. And that fight becomes more important now as we think about who's going to accept a vaccine, Who's going to accept prevention measures? So take something as simple as contact tracing, which, by the way, is not very simple. We know we need to isolate and trace and contact trace folks who are ill. We got to do that. We can do that in a number of ways, all of which will get to the end result of tracing contacts. But what if we thought about that as a community-based intervention instead? What if we went to communities and trained hundreds of members of those communities to be our contact tracers? What if we empowered them? Well, what that gives us is a multi-tiered stacked intervention, right? So we're still doing the contact tracing, but now we're creating new opportunities for people to get new experiences. We're promoting social cohesion among neighbors. And I think oftentimes we look at those as, oh, that's like extra nice stuff. And I think what I'm suggesting is, no. Like, that's the stuff. The contact tracing is easy. It's this part that's super hard. So that's one example of many of how we have to think about these determinants. It's not like we can flip a switch and say, okay, here's the intervention to make this neighborhood more cohesive. It is instead, how do we take the interventions we're doing and modify them in such a way that we promote these social determinants of resilience?
Yeah, great. From our chat function, we have a question. How do you suggest we engage communities and leaders to consider how important it is to change our state health ranking and how that can be a real difference in our resilience for recovery?
Well, you had to ask about health rankings. So let me give you, I'll just say, and this is just Chad Priest's opinion, you just take it or leave it. Health rankings aren't super helpful to improving health. They are kind of helpful to encouraging debate and dialogue. And so and they have actually done a very good job of that. So we rank health and we say, oh my gosh, Indiana's whatever, and we got to get that ranking up. The worry I have is we sometimes start making political and policy decisions. That's why I love, by the way, the job I'm in. I don't get or want to opine on those, but we start making those decisions to get our ranking up. And I think that is a devastatingly bad cycle to get into, because these rankings are really tricky. But the core of your question, I think, is really spot on, which is we have got to figure out how to go to communities and invite them to partner with us for health. And that is not going to them saying, I have this idea for you. Understanding how to organize and mobilize communities begins with respect for the people that live there. Period, full stop. We have forgotten this. We have become largely a group of people who, meaning well, do things to communities. And I will just tell you, that's not a sustainable strategy. So at the Red Cross, we used to say, we want our Red Cross to look like and feel like the communities we serve. And we've really started to say, that's not true. What we want is a Red Cross in every community. And we want the community to be the Red Cross, right? I could train 500 people to come in and respond to fires in your communities. I can do that. We know how to do that. What the opportunity is, what if we mobilize that community to feel like it owned the Red Cross? How do I get out of the way of the community to let it do its thing? And I think that's hard for those of us who care a lot about outcomes, because we think we know the answer. The truth is we don't know the answer. Oftentimes that expertise is embedded in the community, but here's the challenge. That is long, sluggish work. You've got to build trust, you've got to organize, and we often don't have the patience for that. And so I think the clarion call for all of us is, let's get real about understanding strengths-based community assets, exploiting those, not the people in the communities.
Thank you. You've been talking so much about recovery. Do you have a couple examples in all the great years of service, human service that you've had, of communities that have done well after a crisis? They went through the valley and came out the other side and did a great job.
Yeah, absolutely. I'm going to go way back to when I was not doing this work, which is so the very early San Francisco earthquakes. There's a great book I invite you to read. I was turned on to it. And it really is wonderful. It's Rebecca Solnit's book. It's called A Paradise Built in Hell, and it's a fabulous read. And I'm recommending it to you because she does a wonderful job of distilling really complex sociology research around disasters. And one of the core finding of this book is, look, after crisis, people know what to do. We're in Indiana, so if when our power goes out, as it does routinely, we have elevated infrastructure of power lines in my community. And so every time there's a storm, it goes out. And what do we do in Indiana? We look out the window and we see whose lights are on and off. And we think, why are their lights on? This is like a game. And like, Hoosiers are born for this game. I mention that because it follows that shortly after that, if that power doesn't go on, in many communities, we start thinking, well, I think we better do something about this. We're going to have a lot of people. I've got some extra freezer space I could use. This happens in disasters. So after the After the big San Francisco earthquake, people in communities organized kitchens in the street. They self-organized. We see this at the Red Cross all the time. Neighbors and communities bringing us hot dishes to eat, clothes. And it's a challenge for us, right? Because we're trying to standardize and scale a response. And the public health department is not going to let me take your hot dish and serve it to 100 people in a shelter. That's not going to be allowed. But the point of this book, and I think the moral here, is that communities actually know what to do. Our job as NGOs is to sort of back up and let them do it. And we see this over and over again. I went and saw the play, the musical, Come From Away, Come From Afar. I'm screwing it up. It was great. It's about the town in Newfoundland that welcomed the people stuck on airplanes during 9/11. And I loved this thing because it was essentially a master class in disaster sociology. That is not a unique experience in Newfoundland. That is exactly what happens in communities all over, and it's what happens right here in Indianapolis every day. So our job is not to disrupt those efforts, but to amplify them. And at the Red Cross, we think about that as the way to do that is to equip community members with the skills and training they need to help their own communities when something bad happens. So that if they have to open a shelter, that we open it up in their community, at their local church or at the local community center, and that the person running the shelter doesn't come from 6 miles away. They come from next door. And they can do that even if they're impacted by the disaster, because as I told you earlier, individuals are not helpless in the face of crisis. We know what to do.
Mm-hmm. Great. So if you were gonna give us a few closing thoughts on things that we can all do. You've talked about a strategy that's gonna put some accountability on communities, within neighborhoods, within cities. If you were gonna give us a playbook on bouncing back better and taking us from where we are today, particularly with COVID going on, to becoming a stronger city, a stronger community, to be able to bounce back faster. If you were going to give us a quick playbook on that, what would it be?
Well, I'd say that first I would look to all of those decision makers, right? And that starts at the community level, right? From the community elder on the porch who knows everything that goes on in that community, all the way up to the mayors and the council members, and the governors, and everyone else. And I would ask them to consider in every policy intervention how these social determinants of resilience can be impacted. So when we're making a decision about roads or streets or bifurcating neighborhoods or where we're placing community centers or how we're building our environment, that these are considered. When we're dealing with really tough issues of racial justice and equity, issues, by the way, that are extraordinarily important to our resilience. Well, you have seen how difficult it is for us to grapple with the pandemic while at the same time dealing with hundreds of years of injustice towards African Americans in this country. So there is a need, I think, for us to recognize these. I don't have a playbook for, if you do X, Y, and Z. And part of that is because the process of working in the community is the outcome. Simply having the discussion is the intervention. Getting the neighbors together is the intervention. So funders, those that work in the social services space we are right now living through what I would call sort of a tyranny of quantitative measurement. We sort of think if we can't divide or add or multiply something, that it isn't valuable. Of course, we have lots of ways of knowing things. And one of the ways to know things is to talk to people, our lived experience. We make most of our decisions in life without doing any math. That's good for me because I can barely add. And we need to listen to communities who are telling us what they need. We need to respect their voices and lift them up.
Just got another great question on the chat function. What can we do today as parents to help our children become more aware about resiliency and prepare them to improve their future community health?
I've got kids downstairs probably watching this. So if they were here, I would have asked them, hey, what do you think? The generation that we've got right now, these kids going through this pandemic are going to be extraordinary. Think about this. I think about this all the time. I think about the strength of my 3 kids who you would not know. You just would not know the struggles they're going through. And sometimes we minimize them here, which is a good coping mechanism from time to time. You got to move on. You got to keep going. But I see these kids. I see my daughters and my son, and I see them thriving. They're so smart. They're so creative, but they're also scared just like everybody else. And I'm not an expert in kids. I think they would tell you that as well. But what I would say is that this group here, they really are going to understand this, right? They're going to really get it. And I think we start talking to them about it and we start saying things out loud that everyone knows. And instead of that becoming a point of fissure or disagreement, we can all go, well, that makes sense. Like, we will not be able to rescue everyone. So how do we remodel and restructure our society so that it is just and equitable and people have a chance? And then how do we invite them, honor their expertise to go after it? I don't know if that addresses your question, but I'm really optimistic about these kids. I think they're going to be pretty special.
Well, that's a great answer. And it's important, you know, kids are going through as much, if not more than all the adults are, especially as this has been, the COVID situation has been dragging on. I think that's about the end of the time that we have today, Chad. And I want to thank you so much for talking with us today. Your message of hope is inspirational. The background that you have and the role that you're currently in is a huge community impact role. And thank you for sharing your wisdom. We all have some action steps. We need to do the things that you've all suggested. And I would put a plug in for the Red Cross, too, a great organization. If any of you have not signed up to volunteer, please do so. It's an organization that's critical to this community, as in many other communities. And Chad is one of the top leaders in the country, innovating and making new ways for all of us to get involved and have impact. So thank you for everyone joining us today.
Thank you, Allison.
And
Appreciate
a recording of today's discussion. If you didn't get enough of Chad, you can get more. A recording of today's discussion will be online at the economicclubofindiana.com. And in case you missed the first 3 virtual events of the summer, you can check those out online as well. So make sure you keep an eye in your inbox for upcoming 2021 season speakers. We're getting everything lined up and can't wait for that to kick off in September. So have a wonderful afternoon. Thank you again to Chad, and everybody stay safe. Thank you.